Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Good afternoon, and thank you for joining us today for this important discussion. My name is Jada Ledbetter, and I'm Program Manager with the Maternal and Child Health Team at the Black Women's Health Imperative. For those of you joining us for the first time today, I say welcome. The Black Women's Health Imperative, or BWHI, is a national nonprofit organization that is dedicated to advancing health equity and social justice for Black women across the lifespan. And we do this through policy, advocacy, education, research, and leadership development. This year, we are celebrating our 39th anniversary. Over the last almost 4 decades, we have worked tirelessly to fulfill our mission, identifying the most pressing health issues that affect the nation's 22 million Black women and girls, investing in evidence-based strategies, delivering bold new programs, and advocating for health-promoting policies. We believe that all Black women and girls should enjoy optimal health and well-being in a socially just society. Healthy People 2020 declares that maternal health begins where a mother is born, lives, learns, works, plays, worships, and ages. Maternal health does not begin when a mother receives her first prenatal checkup or even when she finds out that she is pregnant. It is shaped by a lifetime of experiences that begin with the earliest exposures to social conditions. As most of us know, the maternal mortality rate for Black women on average is 3 to 4 times higher than that of white women, although there are some places in the United States where the racial ethnic gap in maternal mortality is much wider. Black birthing people are also at a higher risk for perinatal mood and anxiety disorders, with Black women being twice as likely to experience such disorders compared to white women, but less likely to receive treatment or care from healthcare professionals. Maternal mental health practitioners find that the lack of universal mental health education and screening, particularly during pregnancy, creates missed opportunities to counsel patients on symptoms and management of depression, anxiety, and other mental health disorders, and to inform them about resources available to them in clinical care and community settings. BWHI seeks a world where all Black birthing people can joyfully walk the journey of pregnancy, birth, postpartum, and beyond in optimal health, safety, and trust by receiving quality and respectful care. Which brings us to our conversation today. Today, we are continuing the conversation on perinatal mental wellness in honor of Black Maternal Mental Health Week, which begins today, July 19th. Our first webinar in this series, The Path to Perinatal Mental Wellness, a missing link to improving Black maternal health outcomes, highlighted the experiences of Black birthing people with perinatal mood and anxiety disorders, gaps in screening and care, and the path to mental wellness. If you missed part 1, you can watch that webinar and today's webinar again on the Black Women's Health Imperative's YouTube channel. In part 2, The Ripple Effect, Black Maternal Mental Health in the Family, our returning panelists will discuss how the lived experience of disrespectful maternal care, gaps in screening, and lack of support and congruent care can lead to long-term stressors for the entire family. I am very excited for this conversation, and with that, I will hand it over to our moderator, the Director of Maternal Child Health at BWHI, Dr. Kanika Harris.
Thank you, and welcome to the 4th year of Black Maternal Mental Health Week. And this year's theme is Collective Efforts for Greater Impact and Community Change. We are honored to be here with the founder, Kay Matthews, as well. We know that with the overturn of Roe v. Wade 50 years later, this year for Black Maternal Mental Health Week, it just hits a little different. As we all sit with this disheartening reality and reflecting on Black Maternal Mental Health Week, we can't underestimate this increased stress and anxiety and anger that we are all living with right now, especially the impact we are already seeing and have seen facing women, Black birthing people, and family right now in the US. It is a time, if any other, as we live out this history right now, that we take a pause, that we breathe, that we are more mindful and intentional about how we are feeling, that we give ourselves and our coworkers and our families some grace, and that we grieve. And then we breathe some more, and we hold each other, and we yell, and we scream, and we laugh, because we are getting ready to sharpen our swords and go in and fight again. And that's where we are right now. Today, BWHI recognizes the importance of elevating and bringing continued awareness, research, and solutions to creating sovereign spaces, meaning spaces that are full of power and autonomy over creating and manifesting the highest potential and optimal health for Black people and birthing families in the US. So with our maternal mental health conditions, we know that maternal mental health conditions are some of the most common complications of pregnancy and childbirth in the US, and that Black women experience higher prevalence of maternal mental health conditions, particularly postpartum depression and anxiety relative to the US as a whole. Studies show that with maternal mental health, structural racism, which is the totality of ways in which society that fosters racial discrimination and that is operationalized through policies, such as housing, education, healthcare, and employment. And this creates and perpetuates significant inequities in terms of diagnosis, in terms of perinatal and mental health disorders. We also know that if our pain is constantly ignored, as we see in our maternal health journey in this country, then our mental health will be ignored and, frankly, probably won't even be a thought. So it's critical for us to understand why more Black women and birthing people report symptoms of mental health problems, and why we also have the lowest diagnosis and are not receiving adequately treatment for these conditions. Maternal mental health stretches beyond the mother or Black birthing person, and in turn impact the entire family unit. We rarely consider the impact of maternal mental health has on the family unit and partner, but it's important that we do so, that we understand maternal mental health impacts the entire family unit, and it is critical to find interventions that can help address this struggle that we're family and that each family member is also facing. So today, without further ado, we have Kay Matthews, and I'm going to do some abbreviated introductions so we can just get right into it. Kay Matthews is the founder of the Shades of Blue Project and is a licensed community health worker. Kay, along with her team, is on a mission to uplift all birthing individuals with care, respect, and the dignity they deserve, no matter the social status or birth outcome. Based on Kay's own experience, she recognizes the critical diversity gap in mental health, resources, and emotional support for Black and minority birthing individuals, which is what her organization works to dismantle through work on the ground and advocacy. Next, I will introduce our return panelist, Dr. Karen Sheffield Abdullah. Dr. Karen is a nurse scientist and midwife whose interests focus on the utilization of holistic, integrative, and multi-sector strategies to promote physical, mental, and emotional well-being for individuals and communities. She is particularly interested in developing strategies to reduce the long-term health effects of psychological trauma, anxiety, and depression on women's health and birth outcomes. Karen's program of research facilitates the development of culturally relevant interventions to reduce disparities in stress-related adverse outcomes during the perinatal, period, and provide a platform to guide successful models for women's health care provisions and that incorporate stress management and improve wellness across the lifespan. Next, I will introduce our expert, Jimmy Bonds. Jimmy Bonds was born and raised in Washington, D.C. He is a husband and a father of 2 children, Mecca and JJ. He is also an entrepreneur that produces the online radio station Philadelphia Radio and the host of the Jimmy Bonds podcast. He has a background in the arts, songwriting, retail, investment banking. And our last panelist and expert from lived experience is Lakia Williams. Lakia Williams is a licensed therapist and possesses a master's degree in counseling, psychology from Rosemont College. She is a mother of 2, instilling hope and resilience through treatment that is a hallmark of her work. She is privileged to provide therapy and case management to diverse individuals across a multitude of environments. In her spare time, she likes to read with great zeal, create stuff, and parent 2 vibrant individuals who she loves with all the fibers of her being. So thank you for being here. And we are going to start this conversation with Kay Matthews. Hi, Kay.
Hi, Kanika. How are you today?
Good. How are you?
Good. Good to see you.
Thank you. I know you're just coming off another panel, and we're glad for you to be here with us. And you're running to a press conference after this. So we just wanted to start off with, why is it so important that we talk about maternal mental health? Can you ground us in this conversation, and what should we know?
Definitely. This is a part. Okay, so when we think about mental health, we know that it's just mental health as a whole is taboo, right? It comes with all of the stigmas and all of the things that we think we know. But when we're having conversations, we can really dismantle a lot of the stigma that is associated with mental health. To struggle mentally does not devalue you as a person. And that it is okay to not be okay. But the other part of that statement is it's not okay to stay there. And so knowing how to ask someone for help is a big piece. Also knowing when someone cannot help you, how to find that help yourself. Because sometimes, it can be a difficult challenge when someone comes to you and is struggling and you don't know and they don't know. And you're like, okay, you're going to have to figure this out on your own. As the recipient of that, it doesn't feel very good. It just doesn't. But if we are having more conversations like we will have all week, like how we'll have today, then it gets the ball rolling. It also allows folks to know that you are not alone. Like there's other folks that are out there struggling. There's help out there as well, because we need to know that. We need to know, okay, if we talk about it, then what? We need to know that there's a course of action behind it. Who's doing the work, who can help assist you no matter where you are, because we're all connected nationally, right? And so we can direct you to get some help. But it's the conversation starters that's most important, because we are dismantling mental health. And when you put on top of that maternal mental health, we have to treat maternal mental health as a whole, not as an and or part of a conversation. We have to start listening to how folks feel about what is being done with them and to them. It's important. And so the and or conversations are just kind of where we have to, kind of stop and be a lot more inclusive in the conversation around mental health, and not letting the stigmas and things like that stop us from having those initial conversations.
And what happens? What is the ripple effect for our community if these issues remain a low priority and we don't get the help and care, and our communities don't have what we need to respond to each other?
The ripple effect is we continue to go generations and generations thinking that this is the way. For me personally, I wanted to stop the dysfunction, or the acknowledgement that something happens to the women in our family after we give birth. And then we just kind of brush it off to the side. That's what we got to think about. We actually have to talk in terms where people can understand. You know, typically when we would hear about, I remember being young and hearing, oh, well, she different after she had the baby. What exactly does that mean? That's still a continuum right now. People are still saying, oh, she was different after she had the baby. What does that mean? If everybody in the family is different after they have a baby, something ain't right, right? And so when we think about it from that way and we have real true conversations about it, we can stop that. That's the ripple effect. We have the ability to stop that ripple effect from being damaging, because a ripple effect can also be encouraging. It can also help shift a whole generation of folks who maybe before us, they didn't talk about it, but we talk about it now and we want to see change happen. So we work towards it and things like that. So it's too dynamic in two ways. It can be both harmful and helpful. Our goal is to lean more towards the helpful, but we have to address what is harming us as well.
Thank you so much. Now I'm going to bring in Dr. Karen for a second. Hi, welcome, welcome. Thank you for coming back and joining us on this conversation.
Absolutely.
I wanted you to also help us ground us in this conversation before we talk about the lived experience in terms of why and how are Black women disproportionately misdiagnosed and untreated, and what professional service and maternal care can a patient expect to receive after a screening? Like what?
So why are we disproportionately misdiagnosed? I mean, I think there's several reasons there. You alluded to it just in terms of not being listened to in regards to our pain, and then just not even having conversations from clinician or healthcare provider with their client or patient surrounding their stress or psychological distress, meaning anxiety symptoms or depressive symptoms. And then you talked about screeners, and I honestly don't know that the way in which Black women, Black birthing persons talk about depression or talk about anxiety is the way in which clinicians are asking the questions. I don't know that we're actually really getting at what's truly prevalent or relevant, culturally relevant for Black women and birthing persons. And so as we think about screeners, you know, and the measures, the tools that we have available to us to be able to pick up or screen for anxiety or depression, I don't know that we're actually doing a good job of really figuring out what it is for this particular community that's causing anxiety or symptoms of anxiety or depressive symptoms. So I think, one, we're not having the conversations as healthcare providers with this community, probably because we don't know how to navigate that conversation. And that's what I'm hoping, you know, webinars like this, conversations like this will help clinicians as well as patients start to have these initial conversations of what is going on in regards to my stress, what's going on in terms of my anxiety, my depression, or my depressive symptoms. Can we remove some of the stigma associated with even talking about mental health conditions and just normalize it? As we talk about people's blood pressure or weight loss or weight gain or whatever it may be, can we also just have a conversation in our regular prenatal visits surrounding mental health, such that it's not felt like a stigma or, oh, why are you asking me about that? Right? It's just normalized within the visit.
Thank you so much for that. And I'm assuming also that if we're dealing with structural racism and all these other issues, those don't even come up as questions in our visit, obviously. And, you know, those are other conversations we need to work to normalize as we're trying to normalize health equity and issues around racism and sexism, et cetera. So thank you. So go ahead. Did you have something?
No, I was just going to say that I think in one of the ways that we can do better is really educating clinicians. And so that includes nurses, nurse practitioners, medical students, residents, fellows, attendings, physicians, right? Having the conversation with them to help them think about how might they provide culturally humble, culturally relevant care to the Black community, to Black birthing people, and helping them to find the words and navigate those conversations in such a way that it's not feeling like it's judgmental, right? And just opening that up. And that's part of this conversation, but also I feel like part of the work that I'm doing and going and speaking at grand rounds in medical hospitals with clinicians to highlight and elevate the lived experience of what it means to be a Black birthing person in this country right now, right? Especially as we talk about stress and anxiety. And I often say the last 3 years, 3 months, 3 weeks, 3 days is stressful, has been anxiety provoking, and we need to have the conversation. Yeah.
Thank you. Yeah. On that note, I will bring in Lakia to talk about her lived experience and for her to take us through her experience. We talked about her birth and postpartum experience in part 1, and we wanted to go a little deeper into some of just the disrespectful care and just what happened with you in that process. So let's just start with what your hopes and dreams were for your last pregnancy. And how old is your child now? Is it your daughter?
Yes. So I have two, right? So I have a 7-year-old and a 3-year-old. Yes.
Okay. So when Dr. Cameron was talking about the last 3 years, 3 months, 3 days, we are directly talking about you right now.
We're in that time frame.
We're in that time frame.
Absolutely.
Yes. Mm-hmm. So what were your hopes and dreams for your pregnancy, your care, your delivery?
Absolutely. So my hopes and dreams concerning my care, just entering into the space of being a birthing, individual, I wanted to be treated with respect and care. I wanted to be considered to be an expert of my experiences, and I thought that there would be a collaboration, right, of care. This is something that you hear a lot, in the field, this collaboration of care. So I came armed, with my, my personal, lived experience and my knowledge and my clinical experience as well, also hoping that the way in which I communicated would impact the outcome. That's a privileged thought. That's completely a privileged thought. Okay, when I think about the actual experience, but that was what my hopes were. Mm-hmm.
Okay, and so how did your hopes differ from what actually happened? What happened during your prenatal visits? Let's start there.
That's it. So in wanting to bring a lot of my history, and talking about the intersections of how that can impact my care. That was a part of the very first visit that I ever saw, a clinician, a doctor. So I wanted to bring that into the space, and I wanted to make sure that supports were in place. Okay. At every point of discussing my survivorship with traumas that directly impact the birthing process, I was questioned. I was, okay, yeah, that's it. That's a thing, but right. So questioned, at times I was offered interventions that did not align with my birthing plan. Psychopharmacological, intervention when I just wanted someone to talk to and a therapist. So just a number of things. But again, more, equally as important, just my body, the way in which my body was, I was told very subjectively, what my presentation was versus listened to, right? So told that I had, other symptoms that I didn't have. Okay, so I'm like, yeah, so let's get some data on it. Let's get a blood panel. And it's like, no, but we can look at you, we can look at your weight, and we can tell you what. And I'm looking at myself, like, I can't believe that I'm hearing what it is that I'm hearing, and that I'm having to continuously advocate and educate and say, no, that's wrong. And just the blatant disregard for that. Mm-hmm. So, yeah.
And what did that fighting for your care, fighting for respect, fighting for your life and your baby's life, essentially, because if they're not listening to you and not making correct diagnosis, what does that mean for like your stress, your anxiety, your mental health? Like what's happening in the process of trying to bring this baby to term and, you know, have a successful birth?
So I laughed, Kanika, and I wanted to be very, very clear, Dr. Harris. Okay, I laughed because I literally said my PTSD on my inside, on the inside. Okay, when you said that, because my symptoms exacerbated, I mean, significantly. Okay, so in times when I'm supposed to be, fighting, good patterns for rest and things like that, and dealing with insomnia, I'm unable to sleep. Okay, because I'm constantly thinking, I'm constantly worried about the next appointment and how that's going to, further impact, this process. I'm thinking about that timeline. Okay, I'm like, I have this many weeks of gestation. This is how long that I have to go through this. So that was a different set of anxieties. I worried, I'm going to go ahead and say it. I wondered whether or not I would make it out alive, because these were critical points that very crucial players were missing. And I'm like, okay, no, this is beyond ending badly. I could not make it. My child could not make it. So again, with what I shared, in the first panel, I had that moment, where I questioned as a result of repeated patterns of care.
Wow. I'm going to ask that we bring Jimmy on with you right now. Hi, how are you?
Good afternoon, Kanika. Good afternoon.
Good afternoon. I just wanted to bring you in. So as she's experiencing this, as she's doing the best she can, being hypervigilant about her care, making sure that she stays here, and that, your daughter makes it, what is your experience? What are you going through? Because oftentimes we have these conversations with just the mother or the birthing person, and the partner is also affected by this as well.
Yeah, for sure. I mean, I honestly, I felt hopeless and helpless at the same time, if that's a thing. I felt like it wasn't about just not listening to her. It was more just like feeling like you are being discriminated against. Maybe because it's not even maybe, obviously because you're Black. That's one thing. And the preconceived notions that come with that on a regular basis. Trying to give input that you're unfamiliar with. No one tells you about what the process is going to be when your wife gets pregnant and, you're going to the doctors with it. No one explains that to you. There's no book for that, and I often felt myself having to educate myself in areas that I didn't know about before. I'm not, biologically able to have a child. So it's kind of like those things are foreign. And sometimes I think they should be taught in a, I guess, community universal sense, because everybody should know about it. But for me, I was just so ignorant to it. So when I am, watching her go through her appointments, watching her go to her visits, you could just feel not just the anxiety, but the okay, hurry up, let's get this appointment over, let's move on to the next person. It wasn't about her actual care. It wasn't about how the child was doing. They gave us more warnings than they did care, and I felt like that was one of the biggest aspects of them not listening to what she had to say, not understanding what she was going through emotionally and mentally, and physically, of course, and then also trying to break down the notions that they had about people of color in general, on a regular basis. You just always felt like you were on an uphill battle, pretty much.
Did you feel like you were respected as a partner with her?
No, no, I didn't feel like I was respected as a partner with her. From their previous experiences, I guess as doctors, they might not have seen a dad show up to every appointment, and they really didn't educate me or inform me and say, hey, I want you to look out for this with her, check these symptoms out. If she's feeling this way, try this. There was no remedies to how I should help her through this process. And I mean, that was a big void. I felt like that I wish I would have known more about prior to, you know, and I probably would have acted appropriately had it been.
Mm-hmm. So we can't overemphasize the amount of stress that the two of you are under during this pregnancy. And then on top of that, Jimmy, you also became sick, or the both of you were in the hospital at the same time,
Yeah.
dealing with the pregnancy, and then also dealing with just the stress of COVID, the stress of this pregnancy, and just other life stressors that kind of hit you all at once. Can you talk a little bit about that experience, Jimmy, and help us understand? Yeah.
I mean, when our daughter was born in 2015, right before she was born, I had a stroke, and it was from stress. It was from the amount of stress. It was a complicated pregnancy, but of course there were other things going on at the time that were kind of like, you know, just in the surface, just kind of like going on. And it was hard to focus on everything that you needed to do. You know, when a lot is put on one person, the stress level increases. And I'm not saying one person, but in terms of just trying to take care of a household and try to maintain certain things. Yeah, I had a stroke in 2015 and ended up in the hospital for a week. She was 36 weeks pregnant at the time, and she was on the couch with me while she was 36 weeks pregnant, sitting in a heart pavilion. And, you know, it was a very scary time because, of course, I didn't know if I was going to make it. And based on her complications, she, you know, we were high risk. We were high risk. So I mean, I guess you could say fear, but I mean, no, I was definitely scared for what could happen in the future. And you know, when you have a stroke, the rebound is not easy. Because I guess a bit of your mortality is it's questioned. It's in jeopardy, you know. And I felt like, how do you overcome that, as well as be supportive, as well as, you know, take care of your responsibilities at the same time. And I think a week after I was in the hospital, she was in the hospital because of her complications. So we spent another week in the hospital. And then I think probably about 2 months later, we had a traumatic birth. And, you know, I don't mean to sum it up in just a kind of that term, but that's what happened. I mean,
2 weeks later.
2 weeks later. Well, 2 weeks later, yes.
Yeah,
So we had a very, very trying pregnancy. And, you know, just being able to watch her, I guess, persevere through that. It wasn't easy, but I know for a fact that she worked her way through it the best way she could, without the support, you know, the emotional or the just familial support. And, you know, it was challenging because, again, I said, I felt helpless. I felt helpless. I felt hopeless. I felt like, who do you call for something of this nature? You know, who's the person that you're supposed to reach out to get this kind of support? And yeah, it was a very trying time. Something I definitely, you look back 7 years, it definitely changed who I am and my perception on things.
So these are the kind of stories we don't hear. And that's why we hold this space very sacred for number one, and we value you as experts in this conversation, just like any medical doctor, any scientist that help us really see all of the ripple effect, all of the ways that disrespectful care, like you said, Lakia, that you had experiences that needed to be honored before anyone even touched your body as a pregnant birthing person, that were disrespected. And that anxiety and that stress not only affected you, but it affected your partner, who had some serious health complications as a result of that. And I'm sure that stress probably led you to go into labor a little early that you would have expected to as well. So this is just a clear case for everyone on this call. I wanted to bring them back so we can clearly see and understand the ripple effects on, you know, everybody's livelihood, everyone's mental health, and everyone's, you know, quality of life. It's just not that birthing person. And we know, you know, in Black families, moms, birthing persons, you know, we tend to be the bedrock, and when that cracks, everything cracks. And this is an example of that. So I want to go back to you, Lakia, to tell us what you feel comfortable with about that birth.
Yes. So the complications, right? You know, there are some I learned in educating myself that there are some clear markers, okay, for a high risk delivery, okay, which should be delivered, you know, via C-section because of the nature of, you know, of each of the presentation. So there was preeclampsia, there was gestational diabetes, there was gestational hypertension, okay. So those, and they were tracked, you know, in a high risk setting. So there were, you know, I was constantly, you know, being monitored, you know, for things, you know, they're, you know, again, getting those panels and different things like that. I'm watching my levels. Okay. So at the point that, and I'm also saying that by virtue of my lived experience, a C-section would be the safest option. Okay. From a medical perspective, from what I educated myself on, being high risk, C-section would be the safest method. So as I'm expressing this and I'm consistently asking questions, I mean, almost at every appointment we get to, they surprised me. I went to a high risk monitoring session and they were like, hey, we're going to have that baby. And I'm like, my things are in boxes, you know, like I wasn't expecting this. And immediately I said, well, you know, the C-section, like, would everything still stand? I did not understand at that point that if they were choosing to induce me, that it messed with my chances of having a C-section. Mm. And we'd actually gotten to that point due to oxygen levels, due to the presentation kind of, you know, exacerbating that I needed a C-section. Mm-hmm. I still don't have questions to this day as to why it didn't happen. But I have, you know, the injuries with my daughter, okay, that resulted, you know, due to the birthing process. With my son, I went with my medical records on a disc, on a CD, okay? I said, listen, I need to plan a C-section, okay? Mm-hmm. I have, you know, PTSD, you know, this is what happened concerning my first. I was probably 34 weeks before I had confirmation that the C-section was scheduled. I was talked out of the process. I was questioned about the process and why I wanted it after having this conversation about the records and everything else. So just that anxiety of thinking that this could potentially happen again. This is the same body and actually it's not the same body that's birthing, right? So this is a body impacted by the first birth that's now birthing again. And I had to wait until 34 weeks for confirmation that my birthing plan would be respected.
Mm-hmm. Mm-hmm. Wow. And okay, let's all take a breath. This is a lot. And so what you said something, we were talking before, and I wanted to bring this up because it was such a poignant point that you said at one point that you felt like all that was needed for this birthing process was your body.
Yes.
That you felt like nothing else was really needed or respected. They just
nothing else mattered.
Mm-hmm.
Nothing else mattered.
Can you go into a little bit of what you meant by that, or like what that meant to you?
Oh, Dr. Harris. That's a question and a half.
Okay.
So from an intellectual perspective and just communication, I was wanting to open up. I wanted to communicate. I wanted to make sure we're all on the same page. When I got a chance to look at my records, and I saw how my words were changed. When I saw the lack of respect directed to my face, and just flat out a course of action that's completely different from what I'm asking for, I felt that my mind and myself as a person, the advocate that was in the room, like that person didn't matter, my mind didn't matter, my rights didn't matter, right? From an emotional perspective, I felt that there was no place or acknowledgement of how fearful I was. The questions that I had were not taken seriously. So it was such an external just communication. Like it doesn't matter. Okay, but get on the scale. Okay, but finally let's get these panels. Okay, just the body.
And so when Jimmy was in the hospital and you were trying to care for him, I guess there was just no acknowledgement of this critical life stressor that you were facing. It doesn't sound like anywhere throughout your perinatal process, birth, that you were even screened or even asked about support, mental health counseling, anything. Did any of that ever happen?
So I did not receive screenings until I saw a social worker right after the stroke. So when I had to go to the hospital right after his stroke, I asked for a social worker, and that's when the screening process began. I had been asking since my 10-week visit.
And what happened as a result of the screening?
So as a result of the screening process, I was on radar for specific services following delivery, right? So I was already on alert for a home care nurse due to the PTSD that I didn't want to come back to the hospital. I couldn't. It was a really tough time to come back for appointments. So a home health nurse. I thought that I would be able to continue therapy, but because of how everything went with the delivery, and this was like right before delivery. So because of what happened with the delivery, I couldn't go through with, and there was a breakdown in terms of referral, for after I delivered. Okay. So, yeah.
Okay. And so what was postpartum like for the two of you? Because I know that you both talked about severe insomnia, the PTSD. So take us through what, after all of this, you're home, you're dealing with babies with injuries from birth. What was the postpartum experience like?
Kia, you wanna answer that?
I'm going to start.
Okay. Trying would be an understatement. You never know what it's going to be like to take care of a child that has birth injuries. And not only that, you don't think that your child is going to be injured when she's born. So that's something that you kind of have to put your mind in. I guess put your mind in a different place, understanding how you have to care for this child. And if I back up a little bit, just even watching them botch the birth was probably the most horrific thing I've ever seen. Watching my daughter get caught in the birth canal for 5 minutes and have no air to breathe. Watching them break both her arms. Watching them tell Lakia that, in a sense, this was her fault. You develop a level of, and I'm not going to say trust. I'm just going to say you develop a level of understanding. Okay, you guys are doctors. I expect you to have this kind of expertise so that this won't happen. And to watch it happen within the manner that it did is something to say. No one can really put that in words. Let's just be honest. She is having the child directing the doctors on what to do. This is what she's doing. She's directing these doctors on what procedures to take to bring this child to life. So when we walk away from that, knowing that our daughter's injured, knowing that we have these injuries, Kia has these injuries herself, the postpartum was probably the hardest time I've ever had in my life. Trying to pick up the pieces, trying to figure out how I'm going to care for this child that has these injuries. I didn't know anything about a DCIU or therapies, occupational, physical therapy. I didn't know anything about that. Speech therapy. I had no clue about any of these things. And I wasn't prepared for what it would take. And, you get used to it as it starts. You're like, okay, so what's going on and how's it going? I mean, and the small caveat was that prior to us having Mecca, Lakia actually serviced children in the spectrum. So she was very used to what it took to, what type of therapies a child would have. And I felt so dramatically, the fact that the children she took care of, we're now in that same category, made me feel very defeated.
Mm-hmm.
Like, did I mess up? Did I do something wrong? Were we not on it? And it's like, no, it wasn't something that we did. It was what happened to us. And to have to accept that and pick up the pieces and take care of a family and keep pushing without, therapy was a very, very tough time. Very tough.
Did you ever receive or get therapy or offered therapy to this day?
No. I mean, Lakia took a long time to find a proper therapist for herself. She worked due diligently to make sure that she got what she needed as far as like finding a proper therapist she could sit and talk to. For me, it was more, I guess I just never did. I just never did. I tried therapy. I tried to sit and talk to a therapist, but I felt like it was hard to connect with a person that doesn't understand your background or what you've been through exactly. And for them to give a clinical diagnosis of something, I mean, if you were married to a therapist, you understand what good therapy is. Mm-hmm. So you sit down and talk to someone who really can't, get you going. It's a challenge. And that's not all therapists. It's not anything of that nature, but it's more just like you have to connect with that person in order to open up and be open with them to start the healing process. And I felt like, I never found that person. And, I was diagnosed with depression and anxiety years later, probably from the pileup of everything else. But I definitely know that I had that situation. So my mental health was affected as well.
Wow. Lakia, I give you space to take it in and chime in if you feel comfortable.
Yeah, so it was just to kind of move backwards. It was so heartbreaking as a provider to hear of his experiences with finding a therapist, and then with finding a therapist, just feeling that disconnect and not feeling like a priority within the sessions. Also, I knew exactly what he was experiencing. And I know that it's something that happens, it was really hard for me to find a therapist, particularly with the type of insurance that I had. I was not in a position to pay out of pocket, and the wait lists for services through insurance were outrageous, absolutely outrageous. So I found myself getting on a couple wait lists, but then I actually started my doctoral program 8 weeks postpartum. So when I got to campus, I'm like, where's the therapist, right? So the caveat where I was that the campus counseling center was ran by students from my program, right? With supervision from a professional, but ran by students in the program. So I wasn't able to attend that clinic. And I did not find out about the other therapist. And Ruth, I will never forget Ruth affirming this. She said, they never tell you guys that I'm here. So that was 2.5 years into the program. Both, waiting for the wait list, okay, or something in network to come up, and then that barrier there.
Wow. Thank you for this. I'm being mindful of the time, and I want to also add Karen back into Dr. Karen into this conversation as well, so that she can just talk to us from her perspective about, what were the missed opportunities, and, just what. But this is a lot to take in. We didn't take all this in the first time. And so when we hear this or stories like this, what do we need to do? What are the missed opportunities? Where do we start?
Look, I don't even know where to begin. Honestly, just wanting to honor Lakia and Jimmy for sharing what you shared, and the level of depth and breadth of kind of deeper conversation than we had in part one, which helped me to gain a better understanding of just how egregious what has happened to you. I was going to ask if we could have them on the screen because I want to see their faces. Just starting from the prenatal care and what she had envisioned, which really is not a lot to ask for, right? Respectful pregnancy care, respectful maternity care. And the second priority that I heard was that she would be recognized as the expert for her own body based on her own lived experience and what she knows to be true for her. And she received neither, which is just egregious. It's quite honestly just unacceptable. I think I said that in part one. I feel the same thing in part two. Unacceptable. To have experienced trauma prior to pregnancy and feel re-traumatized during pregnancy and then during labor and birth is just disheartening, quite honestly. And quite honestly, even in 2015 and 2018 or 19 and now in 2022, how is this where we still are with all that we know to be true regarding the lived experience of Black birthing persons in this country, how conversations are supposed to be shifting regarding maternal morbidity, mortality, certainly regarding mental health, elevating that, and yet and still, she said, I need X, Y, and Z, and that was not honored, right? And so what I understood from what you were saying, Lakia, is that you had what we call comorbid conditions, right? Hypertensive disorders of pregnancy, preeclampsia, gestational diabetes. And you're saying, I think what I know to be true for me is I'm going to need a C-section. How about that, right? I'm going to need a C-section. And that was not listened to. In fact, it sounds like it was dismissed. And then they surprised you with, we're going to induce you today, right? We're going to induce you. So something changed in your labs without me knowing the full story. Something changed, which then, whether it's the labs or the testing that you had, maybe ultrasound, whatever they saw, they said, you know what? We need to go ahead and get baby out. But instead of saying, let's go ahead and do a C-section as she has requested, let's actually do the opposite and induce her into a vaginal delivery, which then from what you've shared sounds like turned into what we call a shoulder dystocia or of some sort, baby got stuck.
Exactly.
Right?
Exactly.
And there are maneuvers that we do to help get baby out, which can be very traumatic, right? And so it sounds like it was not only traumatic for baby, it was traumatic for you and the birth canal, right? In order to get baby out. And now baby has long-term, what we call sequelae or consequences from this traumatic birth that could have been avoided had we as clinicians listened to the person who was the expert in their own lived experience and body, right? And then recognizing within that also the trauma of Jimmy's stroke, right? Prior to, but still all of that. And to hear that you had to ask for a social worker, what's wrong with the system?
Yes.
What's wrong with the system that the patient had to ask for a social? How did we miss all along this prenatal course an opportunity to say, we need additional supports, resources for this family in the setting of PTSD, right? How is that possible? So, and not only that, and I won't go on much longer, but I do want to say, what I also heard you say is, I didn't know if I was going to make it. You said, I'm just going to say it. I didn't know if I was going to make it. And I'm going to say it. What I am hearing more often than not in the work that I'm doing is Black women and birthing persons saying that.
Thank you. Thank you for
having that very real recognition. I may not make it. And what I want to elevate here for clinicians and healthcare experts in the field, imagine if that is your lived experience. Can we take a moment to think about what that must feel like? I may not make it, right? And what I've also heard other Black birthing persons say is, if I don't make it, do whatever you can do to save my baby. Having those conversations, that's trauma. We don't need to sit here and try and really complicate definitions of trauma and what trauma means. That is trauma. When you're navigating your own very real mortality and not thinking to say, let's address mental health concerns, we're not listening. And we absolutely, if we take nothing else from this week, is to understand that Black women need to be seen, they need to be heard, and they need to be valued. And they absolutely need to be recognized as the experts in their own care. I feel very passionate about this, and having listened now even more to the story, and then thinking about all that comes with the subsequent pregnancy, right? And the anticipation, are they going to listen to me? Are they going to listen to me? Are they going to listen to me? And not know until 34 weeks that they're actually going to do what you've been asking to do from last pregnancy, right? I just want to honor what you shared, honor that you are not alone, because I've heard this, and it's absolutely heartbreaking to hear this, right? And then also just thinking, you're more than just the vessel that's carrying the baby, right? People want to prioritize the baby, but they're not thinking about the entire person. One of my mentors talks about this. It's just like, the woman is the wrapper, right? And the baby is the piece of candy inside. And then once the candy's here, we just discard.
Discard, yeah.
Right, right. And how do we do better? I think we know better. I do believe we know better. We need to do better, right? I absolutely think. And when you say, I wasn't screened until I got the social worker, I'm still not clear on what that screening was. Was that screening for PTSD? Was that screening for depression? Was that just screening for anxiety? What kind of screening was happening? And how was
it was a BDI. It was a BDI, Dr. Karen. Yes, it was. Mm-hmm. So that didn't address the PTSD or anything.
Right. So within the broader context of thinking about your holistic health, mind, body, right? Dr. David Satcher, you cannot have health without mental health, right? So addressing mental health in order to be able to impact our health. And it's more than a depression screener. in somebody who has a history of PTSD. So I'll stop there, but just wanting to say, look, I've got notes, y'all. I was really just quite struck by what you shared. And lastly, to somehow have been blamed for the reason why this was happening.
Yes, what she said out of her mouth is when a mother is obese and a child has macrosomia, that was the first words out of her mouth after she broke her arms. Yeah.
Wow. Right. So yes, not wanting to have ownership of what they missed.
Yes, ma'am.
Right. Yeah. Absolutely.
Thank you. I definitely want to keep Lakia and Jenny here and bring in Kay to chime in and talk to her and close us out for our last 15 minutes. Thank you, Dr. Karen.
Hi.
Hey. That was a lot. That was a lot.
Unfortunately, it's our reality, right? These are the things that are happening right even now as we have this conversation. We deserve better, and so our system itself has to do better. Our mortality and morbidity rates will go nowhere as far as Black people are concerned, because this is how they treat us. This is the outcome of what is supposed to be joyous. I start to now think at childbirth is, we say it's supposed to be joyous, but why are we always on the receiving end of the joy that is non-existent? I continue to send healing vibes and energy to you both, because one, it is very difficult to share your story with people, but when we do share, we are able to encourage others to speak up, because this thing is happening. And unfortunately, it's happening to us more than it's happening to others. Yes. And this can't be life, right? I mean, that's our reality. And so mentally, we are struggling, and physically, we are struggling. And who wants to have a baby and always have to fight? I got to deliver the baby. I got to fight you to make sure the baby comes in. Then after this adverse thing, this thing that y'all did and try to put back on me, I didn't have to deal with that, because I'm pretty sure that there was some blaming of oneself after this happened. When I delivered my daughter stillborn, I took complete responsibility for that, really, but no one actually really guided me to say that I shouldn't, in so many ways. Although people would say it's not your fault, but what we say and how we say it is another thing.
That's right.
Mentally, that messed with me, and so I understand it. And so if we keep skipping over addressing what has happened to people, also understanding that stress and what stress causes, it's like one thing after another. It's never just that one thing. That's it right. Becomes like 10 to 15 other things. And you like, when do I catch a break? Like, right. When can I breathe? Although people are telling me to breathe. When can I breathe?
That's right.
When do things stop falling so out of place where I can catch my breath? Like, again, this is not living. This doesn't always have to be a continuum of our experiences. And so again, us having this conversation lets people know that if they don't think that this data is real, because we also need to understand that the numbers that are out there are tied to real people. We just heard real people. Yes. And these people on this call today are the data. And so if you are not moved by this story or moved to just do something different, I am confused. And so we are delivering our babies in a system, one, we know that was never designed to care for us to begin with. And so when we think about dismantling this system and making it better for ourselves, it is going to be a fight, because we've never had anything easily handed to us. But what it is going to take is our collective effort. It is us working together, because when a couple of us are gathered, we are powerful. But when a lot of us are gathered, we have already seen that, right? We've seen it when we think about what happened with George Floyd. We got out in the midst of a pandemic. We didn't care at that moment if COVID was at our door or in our backpacks. We didn't care. We showed up. But this is how we have to look at this issue. We are in a maternal mental health crisis. And because we have another crisis going on, it's like, hey, now, Black people, one crisis at a time. Oh, no.
That's not how it works.
But this system is giving us more crises at one time. So who are you to tell us what is one going to take precedence over the other? And this is where we sit. But it is us working together. It is us being unafraid and unapologetically saying that y'all are killing us and we ain't asking y'all to. This is really affecting our mental health. This is why mental health comes with such a stigma as well. It's like, I'll give you a little bit of a grace period, right? So if this happened to you a couple of months, I'm expecting for you to be over that. I'm gonna need you to be living your life. Who said? But those are the limitations and the constraints that we put on one's mental health. Like, you got this time frame. It's just like thinking about the Medicaid. After 6 weeks, the people think you're supposed to be good. Who said? So we continue to operate in these different constraints that are barriers to us. So these barriers exist, and then you put another layer of barriers there, and then these are our outcomes, and then you just want us to go ahead and live our lives and deal with the consequences of your actions. We're struggling.
That's it.
And we're not given the space and the opportunities to have real conversations like this where accountability comes into play. That's where we sit right now. In our just maternal health care, our maternal mental health care is accountability. On one side, we're damaged because of your actions. On this other side, we didn't have to go about our days and deal with and mask that because that's just how we are, right? So full circle, Kanika, we're in a crisis that it is going to be us, unfortunately, as a continuum that has to say us. We're gonna save us because they're not trying to.
That's it. That's it.
Thank you so much, Tay. We have a question. How did you all? What are the things you did to take care of your mental health and well-being as individuals and families after the birth experience happened? So that's a question to you, Lakia and Jimmy. Like, how did you make the shift to the place that I'm sure you are still healing, but I guess to the place that you are functional? And then with that question, I would say, Kay, if you can chime in and end us off on what's happening with Maternal Mental Health Week and what can we start doing as a community based on this year's theme.
That's it. So right after Ruth, I started therapy. So that was, Mecca was 2 at the time. Started therapy, and I have not stopped. When institutional change, impacted one of my therapists, I continued to try, and then the pandemic impacted. I still continued to try and call and email, et cetera, while using the tools that I had, while my therapy was very consistent to bridge me over. To this day, as of like 2 days from now, I will be sitting in another therapy session. So it's a continual process for wellness and for processing and for moving forward. Absolutely.
And what we're doing, Kanika, is we're taking this whole week to highlight and uplift. So I definitely appreciate BWHI inviting me to this conversation, because this is how we get started and this is how we move forward. So throughout this week, we will talk about our joys, our pains, and everything in between, because this is what we need to do I am hoping that even the conversation that we are having today, that it offers some type of healing to you both and to those who are watching it now or will watch it down the line. This is what we need, y'all. We got to start showing up. And that's what this week is about. I don't want to have a Black Maternal Mental Health Week 10 years from now. That was never the goal. I want people to understand it, get it, acknowledge that we struggle, and get us access to healthcare, mental health care, full circle, all the way across the board. So we don't have to keep knocking on the door saying, let us in. We're there, we're getting what it is that we need. And so that is what this week is all about. It is simply comes down to our voices being heard, our issues being acknowledged, and then having our collective effort as community-based organizations, agencies all the way across the board come together and address this issue collectively with the solutions and things that we know work, because we know what our people need. We just need to get it going.
Amen.
Thank you so much. And I just want to acknowledge that the collective experiences we are experiencing as families, a lot of times we miss out on our partners and our men in this conversation. So I just want to uplift and highlight Jimmy as well for sharing how, you know, this impacts the whole family, and coming together as communities, coming together as families. You know, we can't have healthy communities without healthy families. We can't have healthy families without healthy individuals, right? And so all of this is at play, how we support individuals, how we show up for the family, and then how we're able as families to collectively help each other as communities is really key. And so this week, we just really uplift these stories. As Kay said, the data is so important to see and hear from the faces behind the data. The data and the numbers really don't do us justice. It tells us how bad things are, but it doesn't tell us the why and the what. And so these stories are so important. You know, this is our technology. This is our way. This is our resistance of explaining and honoring why we need the help that we need, and why we end up in the situations we end up in, that in fact, these are not our fault. And I just want to just thank you for this time again today. This was absolutely an enlightening story, a healing story. We want to focus more on families and the people we are not out here alone. Okay, Black women, Black birthing people, we're not out here alone. We have partners, we have children, we have, you know, families surrounding us, and this is impacting everyone. And this is just a clear example of how this impacts everyone. We will continue to fight through advocacy. Kay is on the ground. I encourage you again to go to Shades of Blue Project and see what she's doing and how you can be involved. BWHI, we're doing advocacy. We're doing research with Dr. Karen, and we're really working to change this picture. And like Kay said, we got to meet Kay's objective that 10 years from now, we will not be here having this conversation. It will look very different. So thank you, thank you, thank you. Thank you again to Kay Matthews. Thank you, Jimmy Bonds. Thank you, Lakia Williams, for not only being an expert on this conversation, but the therapy you also provide as well for clients every day. And thank you, Dr. Karen Sheffield Abdullah, for your work. And I wanted to uplift your organization, Brave. Can you help me?
Brave Company. Yeah,
Brave
that's the name of my company. It stands for Boldly Resilient, Authentically Valued, and Expecting.
Yes. So I want to uplift your work as well. Yeah. So we are at time. Thank you all for being here with us today. Stay healthy and be well.